Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor. Thank you for seeing me today.
Good afternoon. Please have a seat. What brings you in?
I've been experiencing chronic knee pain for the past couple of months. The pain is in my right knee, primarily.
Does the pain worsen with activity, or is it constant?
It gets worse if I walk a lot or stand for an extended period.
Have you experienced any swelling or stiffness around the knee?
Yes, there is occasional swelling and some stiffness when I wake up in the morning.
How old are you?
I'm 55 years old.
Have you had any injuries to your knee in the past?
I had a minor sports injury about 20 years ago, but nothing major.
Are you currently taking any medications?
I am on medication for high blood pressure, but that's it.
Any family history of joint or bone issues?
My mother had arthritis, and my father had hip replacement surgery.
All right, your vital signs are within normal ranges. Pulse is 75 and regular, temperature is 98.6, and your weight is 160 pounds. I've also examined your knee. There's mild swelling and reduced range of motion. It sounds like you may be experiencing osteoarthritis, particularly given your age and family history. I recommend getting an X-ray and possibly an MRI to confirm.
What are the risks associated with this condition?
If left untreated, the cartilage and bones may deteriorate further, which could lead to increased pain, decreased mobility, and potential disability. The risk associated with imaging tests are minimal, but may include exposure to radiation for the X-ray.
What's the next step?
If the diagnosis is confirmed, treatment could range from medication and physical therapy to surgical options like knee replacement, depending on the severity. Risks associated with surgical procedures include infection, bleeding, and complications related to anesthesia.
Thank you, doctor. I'll proceed with the X-ray and MRI then.
Sounds like a plan. Let's reconvene after the test results come in to discuss your options.
Certainly. Thank you, doctor.
You're welcome. Take care.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. Good morning. How can I assist you today? I've been experiencing constant headaches and occasional dizziness. How long have you been experiencing these symptoms? About a month now, doctor. Do you have any other symptoms like blurred vision or nausea? Yes, blurred vision occasionally, but no nausea. What's your age, if you don't mind me asking? I am 45 years old. Have you had any other illnesses or treatments recently? I was diagnosed with hypertension last year and am on medication for that. Which medications are you currently taking? I am on amlodipine and metoprolol. Any medication allergies? No, doctor. Does anyone in your family have a history of migraines or any neurological conditions? My mother used to have migraines. All right. Your blood pressure is a 145/90, heart rate 72, respiratory rate 18. Your weight is 180 pounds, and your temperature is 98.2 degrees Fahrenheit. Your eyes look clear, and no issues with the ear, nose, and throat have been noted. Neurologically, you appear intact, but showing signs of orthostatic hypotension. Given your hypertension and the symptoms you're describing, I'm concerned about the headaches and dizziness. These symptoms could be side effects of the medications, poorly controlled hypertension, or another issue altogether, like migraines, especially with your family history. I would like to adjust your hypertension medication and possibly refer you to a neurologist. Additional tests like an MRI may be necessary. Thank you, doctor. What should I do in the meantime? Until then, please keep a log of your headaches, when they occur, how long they last, and any triggers you can identify. Continue taking your medication as prescribed, but monitor your blood pressure closely. Also, limit sodium in your diet and exercise regularly to help control your blood pressure.